Today we have started monitoring after we launched the mass vaccination for prisons for both inmates, staff and staff families 2 weeks ago. So this week we are doing monitoring in the whole country to see what the vaccine uptake has been. The purpose of this exercise is we want to hit certain targets. We want to make sure that all our prisoners, all our inmates, all our staff members and all their families are all vaccinated, 100% vaccination. Since COVID hit, the inmates have not been able to be visited. And this is because we do not want to introduce COVID into the prisons from visitors who are coming to visit the inmates. And after lots of consultations with the Ministry of Health, the only way we can resume visitation in prisons is by making sure that all the inmates and all the staff are vaccinated, so that in case any visitor comes and they have some form of infection, then the inmates are safe and it's not going to be spread. So there's been lots of challenges with them not seeing their families, psychological health, mental health issues, which need to be addressed. And also certain basic needs of soap, toothpaste, toilet paper are a challenge. So we need to remove that burden from the prison officers who have been assisting to a great extent and return this responsibility to the relatives of the inmates. This monitoring is going on today. We started in Northeastern in Garissa. We've gone to Tana River. We have been to Lamu. We are now here in Malindi. Tomorrow we'll be in Taita Taveta. And then we go to Manyani, Wundanyi, and then we finish the coastal region. And then we will then start off with the Rift Valley, Nyanza, and Western region for the rest of the 3 days. Let me emphasize that vaccination is actually voluntary. It is voluntary. So even as we are saying it is 100%, it is after sensitization. The reason why we have not hit 100% is because there are still some people who are reluctant. So because we are not forcing them, we are sensitizing them. And statistics have shown that the people who are getting COVID and being hit hard by COVID are actually people who have not been vaccinated.
The supply chain of vaccines has greatly improved. Currently, we are rolling 2 types of vaccines, that is AstraZeneca and Moderna. But also we have Johnson & Johnson that just arrived, and we should start rolling out as from Thursday this week. In total, we have put the citizens under the vaccination program about 38,000. And out of these 38,000, about 5,000 have been fully vaccinated. So the uptake has improved. Kilifi, as you all know, we started late. There was a bit of hesitation. But we wish to also thank our political leadership because they came out and gave assurance that vaccination is good for the public and for our also workforce. So we have seen the uptake greatly increasing. We have recently also started an outreach program where every sub-county beyond the initial single station is able to get many more stations that take this vaccine closer to the people. For the prisons, this we have been giving a special service which has worked pretty well so far by doing a targeted allocation of testing kits, doing the sample referrals and all that. And if you look at our records so far, we have tested as a matter of positive cases cumulatively. We have recorded around 317, and out of those, about 315 were actually inmates. All of those have since recovered. So as we speak, in our isolation facility within the prisons, the official record we have as a county government is that we do not have people isolated there. And we are hoping that situation with the improved vaccination, of course, will go down.